Hi, a very good afternoon, everyone. Thank you so much for making time and joining us this afternoon for our NUS Swee Hock School of Public Health online open house session. Before we begin, here are some housekeeping methods to note. Kindly mute your microphone and switch off your video during the presentations. Please submit your questions using the chat function at the bottom of the meeting screen. You may do so anytime before and during the Q&A session. Our very first session speaker is none other than Dr. Raymond Lim. He is the Director of Public Health Minor and Second Major Programs at the Swee Hock School of Public Health. And today he will be talking about the reasons why study public health. Without further ado, I hand the time over to Dr. Lim.
Thank you very much, Jotham, for the introduction. Good afternoon, everyone. Welcome to the online NUS Open House. I want to kickstart the session by giving an overview of what is public health. Hopefully, this can help you to clarify some of the myths and misconceptions surrounding public health and give you some insights into what public health professionals do. I will start first by asking you a few questions. Not to worry, these are not the questions for NUS university entrance examinations, but it will probably trigger you to think more in depth as to what really constitutes public health. First, does public health encompass the control of disease and promotion of health through sanitation measures to ensure a healthy environment? For example, around 500 BC, we know that the ancient Greece and Romans have already begun actively practicing community sanitation measures. Then, is it public health role to prepare for disaster response, both for natural disasters as well as human-made threats? Or is it even public health role to prevent and control the various risk factors of present-day chronic diseases, such as unhealthy dietary habits, physical inactivity, sedentary behavior, smoking, and etc.? Or closer to today's context, is it public health role to prevent and control the various outbreaks and epidemics arising from novel and emerging infectious disease? If your answer is yes to all of the above, I congratulate you on appreciating the broad spectrum of public health work. If the answer is no to any of the above, then all the more I encourage you to stay on for this talk so that I can clear up your misconceptions. I refer you to the definition of public health given by Professor Charles Edward Winslow, who was a highly regarded American public health expert. His definition of public health remains highly relevant even in today's context. He defined public health as a science and art of preventing disease, prolonging life, and promoting health through the organized efforts of the community. This is very in contrast to clinical medicine, which focus on the individual patient and treatment. But for public health, our focus is always on prevention, which is much better than cure, and on the community. How about now we take a look at the public health situation in Singapore? In Singapore, public health professionals work as executives, manager, and even director positions in various settings, some of which are healthcare-related statutory boards and agencies, hospital operations and affairs, healthcare, human resource, finance, community health, and even the regional healthcare system. They implement various public health promotion programs, develop policies, administer health services, conduct research, and regulate the health systems to improve community health. Indeed, the scope of public health is very broad, particularly when you're talking about today's context. Taking obesity as an example, it is not only a global public health problem, it also affects Singapore. Obesity is influenced by a diverse range of factors, from individual lifestyle behavior to upstream factors, involving food, physical activity environment, policy settings, and even economic systems. Tackling this public health issue therefore requires action by various parties. Public health related work in this area could range from educating the population on healthy eating habits, designing and changing the environment to increase population physical activity level, working with stakeholders such as the food industry to develop healthier food products, to even creating and evaluating healthcare financing policies. Therefore, given the wide range of public health work, the field is indeed multidisciplinary in nature. It is therefore not surprising that modern public health work requires professionals from various diverse backgrounds. These diverse disciplines, which are not exhaustive, include life science, psychology, sociology, geography, social work, economics, communications, computing, engineering, architecture, business, and many others. As can be seen, these disciplines are also the first major of most of NUS students. Therefore, public health has a second major or minor would be highly relevant and complement most of NUS students' first major. It will also open up another route of employment for you when you graduate from NUS. So why would you, as a prospective NUS student, be interested to enroll in our public health educational programs? Now, we posed this question to our students through a study, and we found that there were top 5 reasons for them doing so. Now, check out these reasons to see whether they apply to you too. Among those who were keen, a quarter felt that public health modules were interesting. Another quarter felt that it is relevant in today's context, especially we know that Singapore is grappling with an aging population, and many of the health problems we are facing today has a social dimension to it. 1/5 hoped to obtain more comprehensive training in public health. Another 1/5 cited the prospects of securing a job in the field of public health or healthcare. The last 1/10 felt that it would be complementary to their current first major. The Swee Hock School of Public Health is the only national school of public health in Singapore. We currently offer the minor and second major programs in public health. I show here some of our program objectives. The minor allows students to appreciate the multidisciplinary role of public health in preventing disease and improving the health of communities. Our second major is designed to complement students' first major, grooming their soft skills and perspective to work efficiently as public health professionals or in public health teams. In present-day context, students will then graduate with the knowledge, the approaches, and the skills to address public health challenges and improve population health. Ever since the start of the minor program in public health by our school, we are pleased to announce there's an increasing uptake through the years. In fact, this is now currently the second most popular minor program in NUS now. For the second major program, which was just recently offered, we are still in process of collating our evaluation data. For the evaluation of the minor program, student feedback has been largely positive. As you can see here, students found that our lecturers are passionate about their fields, and more importantly, the program broadens their career opportunities because it is recognized by a lot of public health employers. As of 2021, we are pleased to announce that we have about 410 NUS graduates with a minor in public health, and the numbers are still increasing. So where do students who receive public health education potentially find employment? Now we show you here the various settings, right? The list is not exhaustive. The first group would be the international public health related organizations. The second group would be your ministries and the various governmental agencies. The third group would be the public and private healthcare organizations. Right, the fourth group will be your non-governmental organizations and foundations and NGOs. Last but not least, the fifth group will be your pharmaceutical companies and organizations. Then one question which could come to your mind as a prospective NUS student is that, could I try a few modules to see whether public health indeed suits me after I have successfully enrolled in NUS? Now, obviously, you can do that. right? And I'm pleased to showcase you here some modules which could be of interest to you. First, we offer the general education modules where NUS students could use this to fulfill their general education requirements. This is the public health in action module. From the global increase in obesity, which I have touched upon, to more recent health crisis of COVID-19, a range of health issues and solutions will be explored in differing contexts throughout the world. Students, as you would get to work in small groups where you could debate and evaluate paths and strategies to address some of these very important global health issues in a variety of cultural contexts. This will allow you to develop an appreciation of how complex public health problems can be and how they can be prevented or addressed using culturally appropriate ecological solutions. These are the feedback from the module. As can be seen, students like the exposure to a wide variety of topics, and they have learned how public health can be implemented in many other sectors. Next, I'm going to showcase you another module on health of the poor in Asia. This module is offered in special term during the vacation period. The module introduces students to global public health with a focus on health issues surrounding the poor in Asia. Key issues explored by the module include the following. For example, what are the priority health issues that dominate the global health agenda today? What are some of the societal factors that determine disease burden and adverse health outcomes in this subgroup? And of course, what are the community, health system, and policy levels that are available to reduce some of these disparities? These are the feedback from the module. As can be seen, students found this module an eye-opener. They enjoyed the trip, they enjoyed the experiential learning procedure, and they learn not just about healthcare and health systems, but also on the poverty and the societal issues. I know that future career prospects is still an important consideration in your minds when you make the decision to choose a university. So do faculty members like us in our school. We are utmost concerned with the future career prospects of our students. But we are pleased to introduce here the internship module on public health practice, which is a capstone module under our second major program, as well as an elective module under the minor program. Basically, this module introduces students to the public health infrastructure and functions in Singapore, as well as provide hands-on exposure to work by way of attaching students as selected public health agencies. Right, through this, we want you to explore career opportunities in public health, develop the related essential skills, specifically soft skills such as management of resources, interpersonal relationships, communication, and advocacy, and providing you the practical exposure to these selected public health careers. These are the feedback from the module. As can be seen, students really appreciate the hands-on exposure, which allows them to translate what they have learned in the classroom to the real world. They also get to meet experts from different fields. With that, I've come to the end of my presentation. I hope this talk has given you a clearer idea of what constitutes public health. I hope to see you in NUS one day enroll in our education programs. Thank you and all the best. Over to you, Jotham. Yeah, thanks much.
Thank you so much, Dr. Lim, and thank you for that very warm and very insightful sharing. So students, if you do have any questions, you can reserve them for the end of this, this 1 hour session. And next up, I have somebody to introduce as equally interesting and also very insightful. We have Dr. Andre Mueller as our second session speaker, and he will be talking about health behaviors. Really? What's that? And why do we care? So without further ado, I'll hand the time over to Dr. Mueller.
Thanks a lot, Jotham, and welcome everybody. Just give me a second to share my slides. All right, welcome everybody to this very quick session. As Dr. Raymond just said, that sometimes you want to have a taste of something you might want to do. So here is a little taste of a little lecture that we also do to some degree in the School of Public Health. What I briefly want to touch upon is today, I want to talk about health behaviors. Really? What's that actually? And why is it so important? Why do we actually care? And there will be some interactive elements throughout. So I hope you will do a few things live with me here. All right. So what impacts health actually? That's probably a very basic questions you might all ask yourself, especially when you consider studying public health. And when we ask this question, people always think, well, it's probably about my genes, isn't it? Like maybe I have strong bones, so therefore I don't break my bones so quick and have health issues. Or some people might think, well, it's a lot to do with my doctor, whether my doctors are good, whether the healthcare, the medical care is actually great. But in actual fact, health is impacted by many different things. We have here the physical environment, for example. If you look at pollution, that would be a good example to point out here, or also the social and economic environment. So for example, if you struggle with income, you might not be able to afford a certain amount of healthcare, or you might not be able to buy the healthiest food. These are just some examples. However, even all of those factors dwarf in comparison to the impact of health or lifestyle behaviors. And I think you can probably relate to this, how, for example, smoking might have an impact on your health. But I think the interesting thing is that health behaviors, at least that's what we think, have about a 40 to 50% impact on your health. So it's not so much about your genetics, not so much about medical care, but it's really about what we do in our daily lives. So here we have a little bit, a small activity here. So if you can, could you please go to paulev.com/PA health. You can see this at the top of the screen, and just jot down a health behavior you can think of that probably has an impact on your health. So I hope you can do that. Don't let me hang in here. I give it about 30 seconds. Exercise, great. That sounds good to me. Workouts, yep, that goes into the category. Diet, great, yes. Sounds about right. Healthy eating, yes. Washing hands, I think, or washing in general, washing hands, yep. A lot of physical activity and exercise here, which is always quite common. Give it another 10 seconds. Feel free to chip in a little more. So that gives you also a taste of public health teaching. It's not just about telling you things, but also letting you think about what's happening or what's the state of the world in terms of health. Okay, so we have a couple of answers here, and what I find interesting here is that there's somebody writing sitting. That's great. So, but I guess generally we have a lot of eating behaviors, drinking alcohol, exercise, sitting. So I guess what I will see from this practice here is that you're ready to study public health and to probably join some of our health behavior modules. So you have already answered this question, but I will still give you a little bit of a summary here. So when we think about health behaviors, we like to think about the big 6 health behaviors. These are the health behaviors that have been shown to have a huge impact on the health of individuals, but also on the health of populations. Smoking, I guess, is something that everybody knows about. We know smoking is pretty bad for you. And the current guidelines say that you shouldn't smoke at all. You should totally avoid smoking. Hopefully that's what you all do. In terms of alcohol consumption, obviously you should limit your alcohol consumption as much as you can. Although there is sometimes some debate whether some alcohol is actually good, but the research evidence doesn't necessarily support this. So on the safer side would be to drink as little as you can. Dietary behaviors are a huge number of different behaviors. You can think of the amount of bubble tea you drink every day, or hopefully not every day, but maybe every week. Not excess, but the amount of salt you take in, the amount of fats you consume, and how much you eat and what you eat and drink has a lot of impact on your health. So you can see here the guidelines. You're doing pretty well if you eat 4 to 5 portions of fruit and veg a day. So maybe you can think about this. You're also doing pretty well if you don't consume as much sugar. So 50 grams a day, max. 5 grams of salt only, and try to reduce unhealthy fats that are unfortunately in a lot of things that a lot of people like to eat. You think about your fried foods that you can get all over the place. But there are 3 more behaviors. And interestingly, sleep has not been mentioned by one of you. But actually, think about it. We should sleep about 1/3 of our lifetime. As such, we can see that the amount and the quality of sleep probably has something to do with our health. And you can see here the guidelines, probably about your age group, about 8-9 hours would be great if you get that every night. Physical activity, that's what many of you have mentioned. Physical activity has a huge impact on your cardiovascular health, so your heart and your blood vessel health. And the good thing about physical activity is it's not just about exercise. Exercise is just a tiny portion of physical activity. You could also think about walking to the bus stop, going for shopping, or taking a leisure stroll. All those things count towards physical activity. But unfortunately, over time, we have seen that people don't move as much anymore as we become more advanced in our technologies. Nevertheless, look at the guidelines here. 150 minutes of moderate to vigorous activity per week set you up for some decent health. And finally, and I'm very proud some of you mentioned this behavior, it's sitting or sedentary behavior. Over the past years, we realized actually people sit quite a lot. What has this to do with health? And many researchers have now looked into this, and it's pretty clear that the amount you sit every day has a very profound impact on your health, regardless on your physical activity levels. So it's really hard to argue that you can run 5 kilometers a day, but sit 16 hours a day because the impacts are still there. If you're interested in looking into the guidelines, I can just tell you, try to sit as little as you can and try to interrupt your sitting time as much as possible. All right, now you have an idea what the behaviors are, and maybe you remember some of the guidelines. So now hopefully you can go to the polev.com/PA-health on the top of the screen and just give an eyeball of how many of these health behaviors do you adhere to. Are you adhering to all of 5 of them? Are you just about one out of 5 or 2 out of 5 or 6? Or are you really not doing much at all? So give it another 30 seconds. Hopefully you can fill this up and see how people do in terms of the health behaviors. I'm not disclosing mine, or I might disclose mine at the end. Since I'm in public health, I probably do quite a bit of those. Okay, give another 15 seconds. Oh, we have somebody with 5 or more of these behaviors. That is great. You are probably a minority here. Okay, so we can see here, we don't have a lot of responses, but it doesn't really matter. But we can clearly see that very few, thank you for this person who has 0 and indicates it. We can clearly see that most people, in fact, only 1 out of the group here adheres to 5 or more of these behaviors. And the vast majority probably does between 2 to 3 of these behaviors. Let us look maybe into the global picture, just to give you a taste of where you stand. So I titled the slide, "How bad is it about health behaviors?" Because actually the picture is not very rosy at all. When we look at the global adherence to these health behaviors, we find a pretty sobering picture. When we look at smoking in Singapore, we look about 10.5% of people are smoking, but globally it can get up to about 25% of adults. In terms of diet, unfortunately, in many countries, and that also applies to Singapore, probably not to that degree, but it's hard for many people to take enough fruits and vegetables in every day. let's look at overnight sleep. That is also one of my favorite behaviors. You can see there's a very specific pattern here. Whereas in North America and in Europe, people seem to still sleep quite a decent amount. But when we go to Asia, things seem to be a little less in terms of your overnight sleep time. And data from Singapore gives us an even more disturbing picture where people don't sleep as much as we would hope for. And so this is probably a very significant public health problem here in Singapore. Let's look at physical activity. More than a quarter of the world population is not active enough to gain some good health benefits. Let me tell you this. This is a big lie, because when we use devices on our wrists to measure how active people are, we find that actually 75% of Singapore's population does not meet physical activity guidelines. So there is a lot of work to be done. And finally, sitting behavior. As you might guess, about 60% of our time that we are awake is spent sitting. And in Singapore, it's actually between 70 to 80%. So that leaves us probably with a conclusion that most people don't adhere to many health behaviors. That is painful. And so what? Well, why do we care about this? It's very clear, because 70 to 80% of our global deaths, or in Singapore as well, are caused by chronic diseases that link very much to these health behaviors. But don't worry, you don't need to put your head in the sand. You just got to study public health and get some answers on what to do. Okay, almost done, but since we're public health, we also have some very practical activities. So I will do a little exercise break with you now. So if you can, get up from your chair and follow a little movement break video that is 2 minutes long. So I will get up to just be a good role model. So that's part of public health. If everybody can do that, would be great. We'll just take 2 minutes and here we go.
It's time for our quick, refreshing movement break. If you can, just get up for a short while and follow some light moves.
All right, I hope you all did this. We have just increased our physical activity, reduced our sedentary behavior. So all of those things that are very important for public health. That leaves me with just to say the last few things. So we also teach things around health behaviors. It's not all about infectious diseases and maybe big data. We also think about why our health behaviors really matter. We talk to you about, or we spend time on thinking about why people behave the way they do, because we haven't talked about this today. You've got to study to know. And finally, and the probably most important part, we think about and we try to address questions about how do we get people to change their health behaviors. Thanks a lot and talk to you later.
Thank you, Dr. Mueller. I definitely and certainly enjoyed the movement breaks, the 4 different ones. And those are the practical movement breaks, I would say, that all of us really enjoyed. It really breaks the, thank you, and gets us, you know, all our blood pumping again. For those of you who have questions, besides the ones that have been shown on the screen, you may raise them as how some of our friends have done in the chat below, and we will answer them at the end of this Q&A session. And without further ado, we will move on to the next segment of our session. And we do have an alumna and some students to share with us their experiences. So without further ado, I'd like to pass the time over to Ms. Tam Hui Hui. She had a Bachelor of Environmental Studies and a major in Public Health from the class of 2020. She's currently the lead in Impact and Research from Touch Community Services. Unfortunately, she's unable to join us in person today, so she has recorded her sharing and we will be presenting it to you right now.
Good afternoon, everyone. I'm Hui Hui. I graduated with a degree in Environmental Studies and a minor in Public Health in 2020. Most of you sitting here today must have had some idea of public health, which may be why you chose to sit in and listen to this series of online sharings. Unlike you guys, I didn't quite know that a minor in Public Health existed. I first knew about the public health school due to a compulsory module we had to take as part of the environmental studies curriculum. As someone who always enjoyed seeing connections between different disciplines, I was drawn to the public health module for the interdisciplinary lens that it holds. I was amazed at how the environment, both natural and physical environment, how we communicate information, how behavioral change happens, all play a role in influencing public health. In addition, many of my classmates come from different backgrounds. Some major in psychology, some major in business, and others in life sciences. With the different training that we had, we are more sensitive and aware about different issues, helping us add value to what we learn in class in a different way. One of the most memorable experiences I had in my time as a public health student was in the module Designing Public Health Programs. Beyond teaching us skills and frameworks that we may use to design programs in an evidence-based and results-oriented manner, we got a chance to directly practice these skills in the real-world setting. My group got the opportunity to partner with Touch Community Services to design a program for the seniors. We had the opportunity to go down to the center to engage with and conduct in-depth interviews with the seniors. Being able to hear directly from the seniors and engage with them helped us to understand their needs better. We pitched the program to staff from Touch, and we got to hear more about the work that they do on the ground, practical challenges that they may face. This helps me to ground the theories that I've learned in class with practical experiences. I also learned that some of the ideas that we propose that seem to make sense on paper may not always be practical on the ground. Today, I work as a research lead in Touch, the same organization that my group partner with. As a research lead, I work together with colleagues from different services in the organization, youth work, elderly, cyber wellness, special needs, to design, monitor, and evaluate programs. In my work, I continue to use program design skill sets, communication strategies, and behavioral models that I've learned during my time as a public health student in the social service sector. Till today, I often find myself flipping back to the notes that I've taken during my undergrad days, still gaining new insights as I apply what I've learned in my work today. And that, to me, is the beauty of the public health education I had the privilege to have. The learning is grounded in both theory and practical experiences. The learning goes beyond the field of public health. That the learning doesn't stop at the end of classes, but continue as I seek to practice and apply what I've learned in the field that I'm in. If you enjoy seeing connections between different disciplines, learning practical and applicable skills, or making a change in the healthcare or social service sector, consider the public health program here in NUS. You'll find that it adds a different lens to the major you hope to pursue. Thank you.
Thank you, Hui Hui. So with Hui Hui's sharing, we also do have the privilege of having 3 students from different disciplines and different experiences with us today. I'd like to invite them on camera before I introduce them. We have 2 of them who are year 3 students with different majors and have a minor in public health. And we have a student who is in year 4 who also has a second major in public health. So I'll introduce the 2 students with a minor of public health first, and then I'll introduce the student who has a second major in public health. So the 2 students that we have with us who have a minor in public health would be a year 3 business admin major, Hui Wen. Hi, Hui Wen. Nice to have you with us. And we also have a year 3 economics major with a minor in public health, Darius Wong. Would you like to say hi?
Hello.
Yeah, thank you. Hello. So these students are also what Hui Hui just shared with us just now about her experience of having classmates across different interdisciplinary fields of study. And also she had the privilege of practicing her skills that she learned in her minor in public health in real world setting. And the 3rd student that I'd like to introduce to everyone is Ray Min, who is also on camera now. Interestingly for her, she has 2 majors. The first is life science major, and the second is a major in public health. Interestingly for her, she was part of the first intake in semester 2, 2020 to 2021. A little bit of an interesting note for all our prospective students. We have our next intake for semester 1 in 2022 to 2023. And there will be 1 intake for this year. So if you do have questions, you can bring that up later when we wrap up this session. But yeah, let's get started. And with that, I'd like to ask Hui Wen, our year 3 business admin major, a question. How do the public health concepts that you have learned in your minor complement your primary major?
Thanks, Jotam, and hi everybody. Thanks for taking the time to attend the session today. So actually, if you ask me, I would say that inherently the concepts that we learn in both public health and business are actually very different. So for example, in public health, we learn things like social determinants of health, disease prevention, and also like things like policy planning. And in business, however, I specialize in operations. So a lot of the focus is on like how do we improve efficiency and how do we make more profits. So that said, I believe that operations is really something that is very important for any company, especially and including public healthcare institutions. So I believe that the culture in business has also taught me a lot of soft skills. So things like communication and presentation skills, which are really valuable anywhere that I go. I would say that for me especially, because my career ambition in the future is to work in healthcare management. So I really actually appreciate that both public health and business teaches me very different things. And that means that if I hadn't taken this minor in public health, right, I would have probably never ever came across the public health concepts that I now know. So I would say that if you're interested in a career in healthcare, a public health minor or even a second major is actually very helpful. And this is really a right place for you to be in public health if you're interested.
Thank you, Hui Wen. I also noted that you did say that you found there are very useful and relevant knowledge that you have gained from taking public health. And interestingly, Darius, you are a year 3 economic major, right? So wow, it's very different from Hui Wen, who is a business major. Could you share with us on some of the learnings and benefits that you have gotten out of your minor in public health studies?
Thanks, Jordan, for the question. So I think for me, so I took a couple of modules in public health. So one is on epidemiology. I took a module on public health communications, and I also took a module on physical activity. So I would say that one of the key learnings that I actually got out probably like from like my epidemiology module. So actually I learned like to make sense of like different like terms like, you know, incidence and risk, which I think is like very helpful considering now, you know, the news is always talking about like the vaccines and like what are the risks involved. So it helps me like better understand like, you know, all the terms, you know, when they say in the news like the risk of like you know, one actually getting like a adverse side effects, you know, from the vaccine. Yeah.
So I'm sure that like what you have mentioned, it helps you interpret the different terms, make sense of that, and also help your family members along the way, which you have mentioned, it is a direct impact even to your day-to-day and how you even use it to relate to people. Talking about relating to the people and your community around you, I'd like to I would like to invite rather Rui Min, who is our life science major, who has a second major in public health, to share with us a little bit more on how you found this major in public health fulfilling and also very much relevant to your life science major. Could you share with us more?
Yeah, so thanks for the question. I think how I would like to think about it is that life science gives me a very good background on like your biology, like the mechanisms and whatever. And then public health kind of gave me an avenue to practice that. So in a lot of my internships, there's actually a very good like marriage between the both. So I would like to give like an example of my experience as a medical affairs intern at GSK. So I had to go through a lot of scientific papers, and that's where my life science background came into play. But things like public health communication was also very relevant, because we then need to translate all this like scientific knowledge to the layman, so that the layman will understand. And this will require a lot of like it's an art as well as a science. So I think public health really equipped me in that aspect to engage the public in a very attractive way, in a very competitive way, but it's still grounded in scientific evidence.
Thanks, Hui Min. I realized that you did say that this was your capstone, right? That you actually did medical. You're focusing on medical affairs at GSK, and you did mention about public health communication, which is very similar to what Darius mentioned. How that also helped her interpret different terminologies, right? How it actually did support her in understanding epidemiology and the world around us, especially in these pandemic times. So a further question that I'd like to ask you, or even any of our student, Hui Wen or Darius, would be how did that complement, say, with your the future that you envision yourself moving towards? If any one of the three of you would like to take that question, feel free to jump in.
Maybe I'll just talk a bit first, and Darius can really make an add-on, because I believe that we do have quite different aspirations as well. So like I mentioned earlier, like my ambition is to work in healthcare management. So I would say that with all my experiences, like applying for internships and things like that, I feel like a lot of the times employers are always looking for whether the interns or whether the applicants have knowledge of the public healthcare landscape in Singapore, of whether they really have an understanding of it. Yeah, so I think that the knowledge that I learned from public health and the things like, because oftentimes like during lectures, the profs will always bring up some of the prevalent healthcare issues. So things like COVID-19, when it first hit, we actually did a project on it in one of my modules. So I feel like it has really helped me to get a very good understanding of the problems that are facing the Singapore healthcare system. And it has been very helpful in helping me to secure internships and things like that also. So for summer this year, I'll actually be interning with Tan Tock Seng Hospital to work as their management associate. So that's why I say that this public health minor is really very helpful in helping me to achieve my aspirations in the future. Yeah.
Oh, congratulations, Hui Wen. Happy for you that you're at Tan Tock Seng. Also on this note of internships, yes, very important and very relevant. I think Rui Min, I'd like to ask you a little bit on your experience when you did your internship. Could you share more, especially as a double major?
Well, I've taken a wide range of internships in my course in NUS. So I started off as a research intern at NGO. I did a lot of research on young and early onset dementia. So aspects like behavioral sciences, quantitative and qualitative data collection and analysis was very helpful. And all this I gained knowledge in my public health modules. So what I did was that I took all these findings and I generated a report that was used to guide future policy making and program planning in the dementia care space. So the internship was very research heavy. And then, like I mentioned previously, I did a second internship at GSK. And then currently I'm doing very different also. I'm in healthcare consulting now. So a large portion of what I do lies in health systems as well as public health economics. So these two are actually modules offered in NUS. So they really gave me a very good background knowledge because, consulting is something that is very business centric, and coming in, I was a bit lost, but I think these modules really helped me to have at least a bit of an insight, but still there's tons of learning on the job that anyone should expect. Yeah. And also I took one module on public health program design. So I think Hui Hui mentioned that as well. So I used a lot of knowledge from there, not directly designing public health modules, but public health programs. But what I wanted to convey is that the frameworks, the theories that we learn in school are very transferable, even like beyond aspects of public health into other realms of knowledge.
Thanks for sharing that, Rui Min. I think now what I'm seeing is rather a juxtaposition of we have students major in economics and business with a minor in public health, and we have a double major with life sciences and in public health. So I think visually you see these two, and thank you for sharing all of your experiences with your internships. So if I could ask two sides of the room right now, what are some practical advice, as a person who is just trying to find out about public health, have very little knowledge at the moment, and just trying to figure things out? How would you advise them accordingly? Perhaps we could start with Hui Wen and Darius as a minor in public health students, and then followed by Rui Min. Would that be okay? Thank you. So I pass the time over to you, Hui Wen.
Darius, would you like to share, or I can share a bit first?
Maybe you can share first.
Oh, okay. Actually, for me, I joined with no public health knowledge also, so I think it's really very manageable as long as you have the interest in it, of course. Like in my public health modules, I also meet people from very, very diverse backgrounds. So we have even people from like engineering or computer science, which like on like surface level, you might feel like there's not really a connection, but they are just really people who are very interested in public health, and they enjoy the modules as well. So I think in terms of whether you are afraid that you are not able to like fit in or things like that, there's really no need to worry about that. And I think in terms of workload, it is definitely very manageable. Speaking from a minor point of view, I'm not sure about Rui Min, but yeah, because I think for a public health minor, you only have to do I think 20 MCs, so that's about 5 modules only. So actually we can clear our minor before we graduate. So I think for me and Darius, we've both already cleared our public minor, even though we are still in year 3. So yeah. Darius, anything?
Thanks, Hui Wen. I think maybe just to add on, like if I talk about advice, I would say probably we can start off like taking some of like the introductory like modules. So for me, I started out taking the SPH202, which is public health research methods module. Yeah, and then I realized that actually quite a lot of my classmates, not all of them came from like a major that is very relevant to like you might not think it's very relevant to like public health. So I have friends who came from other majors as well, like political science, for myself, econs. I also met people from engineering as well. Yeah.
Very diverse experiences, and I'm sure that also did color your experiences as a student and make full use of your time and kind of help you figure out what you really want to head towards. So thank you as year 3 students, and congrats on your placements and even your experiences. Thank you for sharing. I would invite Raymond to perhaps share with us now, and also to tell us how do you juggle 2 majors? Wow.
Maybe I'll just start with advice first, since I'm sure there's a lot of prospective students here. So I think from the sharing, you can see how public health is very broad and it never works alone. So like with business, with economics, psychology, life sciences. So because it's so broad, right, I would advise students to take as many modules as you can and really explore what you're interested in. So I like to quote one of my professors who always says, be a jack of all trades, but a master of one. So while you're finding that one thing that you want to dive deep in, also keep an open and a curious mind to everything else, and you might just find like something new that you find interesting. And how to juggle 2 majors? I would say it's a challenge, but that's what makes it fulfilling as well. So there are definitely practical steps that you can take to overcome this challenge. So like planning your modules well, you can read up in module repositories to kind of get a semblance of what a module will entail. Like, is there a lot of group work, or is it very memory heavy? Yeah, so there's probably also the possibility of you just do a minor first and then you switch to a major. Yeah, so there's a lot of practical steps that you can take, but ultimately, I think it would be terribly ironic if you were to compromise your mental, physical, and emotional health to study public health. So yeah, just take it as it goes. I don't think you need to declare it now anyway. So if it works for you, just upgrade it to a major.
Well, thank you for that very wise words. I really, what resonated with me rather is that part where you did mention to be a jack of all trades, but a master of one, and finding that one aspect to deep dive in, and to keep an open and curious mind to everything. Wow. I'm just wondering, with regard to that point, you did mention also it's a good time to segue into some of the other societies, perhaps, because we also do have prospective students who wants to understand, wow, how holistic school life is also. So perhaps you could, one of you share about your experience, perhaps, in the Public Health Society?
I can take that question. So I guess this can be my little pitch. So I had the privilege to serve as president of the NUHS Public Health Society. And what I can tell you is that it's a really safe space where you can learn and you can put your classroom knowledge into action. So I think many of us did share about our external internships, but Public Health Society, we actually have opportunities for you to also have some job experience. So I personally did a research project in collaboration with Swee Hock and with the CCA. So it was on sleep habits. So I was involved in like the research question generation all the way to like data collection and report writing. So we do have a lot of opportunities that hopefully suits your interest. You can Google NUHS Public Health Society if you're keen. Yeah.
Yeah, I think maybe I can add on to what Raymond has said, because I'm currently also in Public Health Society. So I'm currently in like the research department of the Public Health Society. This is where I think last year, I remember like me and some of my Public Health Society friends, we actually took part in a case competition, which is about the misinformation and fake news of like COVID-19 news. So I think that's where actually I got to really like apply, what I've learned from my public health modules, like all the frameworks, all the concepts, into for a certain case, like in the case competition. Yeah.
Thank you. Thanks, Darius and Raymond, for sharing about the Public Health Society. So that's co-curriculum. And if any of you prospective students would like to find out more, please feel free to ask these student representatives today. With that, I think we will conclude this particular segment. I would like to ask if you all have any parting thoughts as students for the audience today. Okay, if not, I'd like to invite our two speakers also who were speaking earlier on, Dr. Raymond, and yes, hi, Dr. Raymond, and Dr. Andre Mueller on screen. And I believe we do have some questions, yes, from the floor. So I think we will be asking the first question, and if perhaps Dr. Mueller or Dr. Raymond, if you would like to answer, please just feel free to jump in. There's a question from Christina. Just wondering, how many people usually take public health as a second major in NUS?
Thank you, Jordan. Maybe I will take on that question.
Thank you.
As can be seen, we just only started out the second major, right, very recently. And it was after a lot of efforts put in because a lot of work has gone into it, because we need to make sure that there are career prospects and it's in line with the country needs and demands as well as the university needs and all this. According to our numbers from the previous intake, we have about 15 to 20 students and all this enroll in our second major, right? We wanted to start small because we want to monitor the situation. Right, again, this is something of concern to us, as mentioned just now, because we are utmost concerned with the career prospects of our children, of our students, as well as the employers out there, right? So we wanted to start this, and it's our hope that we eventually increase the numbers, right? Thank you very much. Yeah.
Thank you, Dr. Lim. He definitely sees all of us as his children, affectionately, and potential children. So that little hint to everyone is sign up, and you will, and yeah, immerse yourself in this world of public health, and we can see, you know, how we can contribute back to the society in greater capacities. Talking about this, and since I have you with me right now, Dr. Lim, there's a question for you. Why did you choose to take up public health as your career?
Regarding that question, I think it can be traced back to my medical school years. During my medical school years, we have to be involved in quite a number of community health projects and case studies and all this. The value of public health, the role of prevention, as well as addressing these upstream factors, has left a very huge impact on me when we inquire the case history of these patients. Because very often through these case studies and community health projects, what happens is we'll see these patients in their terminal cancer stage or end stage cardiovascular disease and all this. And very often these patients will share with me how they have regretted in the past of not engaging in healthy behaviors, how their financial difficulties have led them not to be on regular follow-up and not taking the appropriate steps to go for screening and all this. So I think this is very important aspect of our healthcare system, where we need not only doctors who provide that treatment, but we also need public health professionals, right? Because it's our calling to address some of these upstream factors as well as prevention, because prevention is definitely better than cure. And it's something that we want to do, right, as an individual as well as a society, so that we want to address the issue of the tap leaking rather than repair the source, right? So I think this is the motivation and reason why I pick up public health. Thank you very much.
Thank you, Dr. Lim. And there is, talking about, you know, health behaviors, which you mentioned just now, there is also another question for Dr. Andre Mueller. What do you think are some common misconceptions that people have about health behaviors, especially after your movement break exercise? So I thought it's quite interesting for you to add more texture to this question. Dr. Mueller, to you.
I guess the most common misconception we always encounter is that it's all about knowledge, right? And there's this common idea that people don't behave healthily because they just don't know any better. But unfortunately, if it would be so easy, we would have solved the problem, but we haven't solved the problem at this stage. Knowledge doesn't necessarily change what people can do, as Dr. Raymond just said. If you have financial constraints, it doesn't matter how much you know. If you cannot address the upstream factors, there's no chance for you to maybe engage in a certain health behavior. And also, health behaviors oftentimes have very long-term benefits, right? You don't get diabetes when you're 50 years old, but they come with very short-term inconveniences, such as needing to exercise. It's sometimes hard and tiring, needing to eat more fruit and veg, which might not be so nice as drinking a bubble tea, right? So despite us knowing the goodness about health behaviors, it doesn't mean that we translate that into practice. And unfortunately, even if we tell people about their genetic risk of getting diabetes, heart disease, or cancer, even then, people don't tend to adhere to health behaviors. So there's a lot more to it than just knowledge.
Thank you. And I believe they can find out more by joining our
program.
Yes.
I keep the best for later.
Yes, keep the best for later. I believe at this moment we can take 2 more questions. And I see quite a heart-burning question here that is very relevant from Alina. You say, hi, I was wondering, when can you declare public health as your minor or second major? I believe Dr. Lim, would you like to take this?
Yeah, thank you very much for the question. For the minor program, is an open minor program, right? So as long as you are year 2 and before that, you are free to declare it in the NUHS system. If you are after that, you have to seek permission from your host faculty, home faculty, right? Usually it's not an issue. For the second major program, it is a closed program. So it will be by application basis. And as mentioned, right, we will have usually about 1 intake, 1 academic year and all this. So students will have to fulfill certain requirements as stated out. So if for these details, please check out our school website on the criteria needed, since it's a closed program application. Thank you very much.
Yes, and on that note, actually, on the school program, yes. So right after this, I will be flashing a QR code where you can find out more about our programs and more about our school life in the main website. With that, I will be handing over the time to for some parting words from our students and also our main presenters. Do you all have any parting words that you'd like to share with our participants here today?
I guess I can say that we really need you, because we are we do see a huge flood of non-communicable diseases coming our way, and these are often related to our health behaviors, and our behaviors are so important even for infectious disease, be it mask wearing, be it good sanitation, be it not polluting the environment that makes us sick, or be it conducting physical activity and eating healthily. And it's a massive job, and there are lots of opportunities. And hopefully we see you here to equip you with skills, expertise, and competence you need to make a change that we need really to happen soon. Thanks a lot, and hope to see you.
Yeah, I concur with Dr. Andre. We definitely need your help, because public health problems are complex and sophisticated, getting more and more complex with each day. So if you have any interest, do join us and sign up for our public health modules. Thank you very much.
Student presenters, please share as you wish.
Okay, I think my parting words will be, I think we should all treat university as an exploration ground. So I don't think that like necessarily what you're not dictating your future from here on out. So it's a flexible path, and really just enjoy your time in university and learn as much as you can.
I think for myself, my parting words will be to have an open mind in university. What we study, whether or not it's like directly relevant to what you might do in a career. Just enjoy the process of learning, and see if there is anything you actually apply from your studies to whatever you're doing in the future, being like competitions, your careers, or your internships. Yeah.
I think everybody has shared quite a lot, so I think I'll just end off representing all of us to say that, we are really here, we are ready to welcome you with open arms. Just give it a try. Take 1 or 2 modules and you'll probably like it like we did. Yeah.
Indeed, thank you for those wonderful words. With that, I'd like to thank again Dr. Raymond Lim, Dr. Andre Mueller, even Hui Hui, our alumna, who has recorded her sharing, Raymond, Darius, and Hui Wen. Thank you so much for being here with us and spending your afternoon with us. At this juncture, I would be sharing this QR code with all of you that would appear on the screen right now. If you'd like to find out more about us, you can just scan this QR code in front of you and it will direct you directly to our website. And also, if you would like to ask or rather submit your questions that you might be inspired right now to ask, you can do so also by scanning this QR code in front of you. And we will be responding to your question after this session. So give us a moment, a few seconds to scan. Yes, if not, thank you very much for being with us here today. We hope to see all of you again, like what our students have said and our profs also have mentioned. We really love to just share more with you and hope you'll join our program.